Hello and welcome to today's webinar, Youth Peer Support, Becoming a Medicaid Provider, with your presenters from Youth Move National and Center for Healthcare Strategies, hosted by the TA Network. We're very glad that you could join us today and this afternoon, and I would like to let you know that we will be recording today's webinar so that it will be available for sharing with those that cannot join us this afternoon. Very briefly, we will be using the Adobe Connect platform for you to see our slides on the screen. We also have included 3 documents for you available in the Files pod. You can download these. We'll be discussing them throughout today's call, and I believe they might be a resource to support you in your work. We also have a chat feature, and you are welcome at any time throughout today's webinar to chat in a comment or a question. Our goal today is to spend a good chunk of our time providing content for you, and then to leave time at the end for a discussion to make sure that we are meeting each of your needs today. So you may ask questions throughout the webinar, and we'll address them as we may and wrap up with them at the end, and we'll ask for questions again as we end today. So my name is Johanna Bergen, and I am the Executive Director of Youth Move National. We are a youth-driven organization with a chapter membership across the country where young adults learn leadership and advocacy skills to change the systems from which they have lived experience. And we have been spending a good chunk of our time these last several months working on the issue of youth peer support. Youth peer support is a service that we are hearing requested again and again from youth advocates across the country, and we have been working with system of care communities and Youth Move chapters who are working to develop curriculum and training so that they can hire and implement and provide youth peer support to their communities. And we are so glad that you have joined us today. I'd like you to hear from our co-presenters today. So Bree, will you go ahead and introduce yourself?
Great, thank you, Johanna. So my name is Bree Mazzelli, and I work at Youth Move National as the Director of Technical Assistance and Evaluation. And I've been working with Johanna over the last year or so, really kind of building up some young adult peer resources and support. And over the summer, we've been working with Center for Healthcare Strategies, specifically with Diana and her team. So I'll turn it over to her to also introduce herself.
Thanks, Bree. I'm really glad to be part of this webinar today. My name is Diana Simons. I'm a Senior Program Officer at the Center for Healthcare Strategies. The Center is a core partner in the TA Network for Children's Behavioral Health. My background is in children's behavioral health and family systems. I've worked in managed care and in the Office of Medicaid in Massachusetts. And my work on youth and young adult peer support is actually tied to the work my organization is doing on a 5-year quality improvement demonstration grant that's funded by the Centers for Medicare and Medicaid on improving the cost and quality of care for children with serious behavioral health challenges. It's the 3 states, Maryland, Georgia, and Wyoming, have been working on implementing or expanding a care management entity. And care management entities basically are have evolved out of systems of care. And though they're unique to the environments in which they operate and the children and youth and families they serve, they share important components like intensive care coordination, using high-fidelity RAP, and the use of family and youth peer support. So I'm excited to be able to speak with about this today.
Awesome. So you'll get a chance to hear from all of us throughout today's webinar. And we have been working together to develop a guide on this very same topic. And we are basing today's webinar off of the content of this guide, which will be available soon. It's in some final stages of review, and we're hoping to get that out to you sometime in the month of August. And we believe that the combination of that guide and today's webinar, you will have some important tools and resources to use in your community if you are currently implementing youth peer support and hoping to access a Medicaid billable to help finance your peer support, and or if you're considering building and implementing youth peer support and have questions about the Medicaid portion of this. So it will be very helpful for us as a community to know who has joined us on today's webinar. So we have a series of very quick and simple polling questions. And Colin, if we can pull the first question up. All you need to do is select the button that is the best fit for you. And we'll go through these questions quickly. This is helpful mostly for our presenters. All right, excellent. You guys are being very speedy today. All right, great. So we do have a wide range of levels of interest and current knowledge about youth peer support, and that is very beneficial. We'll reference, for those of you that are new to this topic, some additional resources where you can access some of our foundational material. Colin, we can move to the next question. All right, so the next question, does your organization currently offer youth peer support services? All right, great. So about half of us do not provide service. Okay, good. All right, and next question, Colin? So this question is more generally about youth programming. So this would include youth engagement, youth leadership, anything you do in engaging your young adults in your work. All right, excellent. And you will hear me talk in a moment about why this question is important for us. All right, perfect. And yes, thank you. So does your organization, are you currently a provider? Awesome. All right, great. It looks like you have found the right webinar to join. Thank you, everyone. Colin, is that our last question? Oh, no, I have one more question for you guys all. Are you currently engaged in planning for implementation of youth peer support? All right, perfect. Thank you. All right. So today, this webinar for us is one of a number of resources and TA opportunities Youth Moves National has been offering to support your community's work in building and implementing youth peer support. And today we definitely have a specific focus on the Medicaid piece, and are so glad that our work with CHCS can be shared with you today. We do think that it's very valuable to make sure that we're coming from a foundational understanding of what we mean when we talk about youth peer support. And so I'm going to kick us off today having us think a little bit about foundational information that we have and need to have thought about and understand before we make a decision about how to finance youth peer support. And throughout my talk, we'll reference a little bit about the other additional resources where you can find more in-depth information. And so if in your planning process, the things that I'm sharing right now are relevant to you, there are other resources, webinars, and documents that we would direct you to. So on the screen today, we have some of the key points that we believe that you need to have an understanding and in operation in your community to build a successful youth peer support program on. And so if we're looking at what is the infrastructure to building effective youth peer support, this is after extensive work with communities across the country, this is sort of what Youth Move National's list looks like. So we very much believe and see that there is a successful implementation of youth peer support when that specific support is built upon the values and principles of youth-driven care. So the foundation of successful programs are youth engagement and understanding how to support young adults in engaging and having young adults at your table and in your work. And so there's several reasons that this is important. Many of the values of youth-driven care are similar and included in the values and principles of youth peer support. We also know that at the core of youth peer support, there is a relationship between one young adult to another young adult. And we need to have young adults who are interested in being trained to become peer support providers. And we need young adults who are interested in accessing peer services for this to be effective. And so having a foundation of youth engagement allows you to have young adults who are able to participate in your planning process to implement peer and are also able to train and be hired as your first peer support providers. We've done a lot of work with communities and understand that the change team or the planning team that's working to implement peer support in your community needs to spend some time making sure that you all understand and define youth peer support in a common way. There are many forms of peer support, and we want to make sure that you understand what you're building. And in this process, identifying the values and principles of youth peer support are important. When we go about this work of adding this service to our array of supports for young adults, and we need to do this understanding the true value that peers bring to our service setting. So young adults have a very valuable voice of experience within our system, and they are value added in many ways. Your team consider all of the reasons to employ youth peers. We also know that youth peer support needs to be implemented and surrounded by a commitment to creating work environments and organizational cultures that embrace both lived experience as a form of expertise that we value and want on our team, and that we also have a culture and an environment that is supportive and to youth-driven principles and programs. So how are young adults engaged in all of our work, from advisory capacity to work group to providing feedback about the programs that you offer? And this is essential to building a youth peer support that will produce the outcomes that you're looking for. And then we also need to understand that youth peer support is a part of a much larger continuum of supports that can be offered to youth and young adults. And this continuum stretches from the very formal service setting supports to the very informal natural supports and friendships that are found in our community. And I'll talk in just a moment about this continuum as it relates specifically to peer support. But you'll hear me say frequently that youth peer support is one puzzle piece in a much larger picture of the things that we do in our communities to support young adults. So this is a continuum about helping relationships, so the relationships that are in place to help young adults succeed. And we have found this to be incredibly valuable as we describe youth peer support to communities and planning processes. And if you're already well into your planning process, it can be helpful to pause and step back and consider where exactly does the youth peer support that you're developing fit within this continuum. This is one of the handouts that is available in your pod, and you will be able to find out additional information about this continuum by listening to a webinar series we did this past winter. And that webinar series is, the links to the 3 webinars are also available in a document in your handouts pod. And very briefly, as we may refer to this later in today's webinar, this document goes from the left-hand screen to the right-hand screen. The left-hand portion of your screen shares with you one-directional helping relationships. So this is a very formalized service setting. An example is case management, where a young adult receives services, usually within an office setting. There is a person with expertise and credentialing that provides them a service. There is a power differential in the relationships that we see on the left-hand side of the screen. So they're helping and hopefully positive for the young adults, yet they are a person of expertise is giving you, as a young adult, a plan or suggestions or requirements about how to proceed with your care. As we move along to the right, all the way to the right end of the continuum, we end up with the most informal and most natural helping relationship, and that is one of friendship. And this end of the continuum is completely neutral. It's voluntary. A young adult is friends with another person because they want to. And it is also a helping relationship. And so the question for you to consider is, where does your youth peer support programming fit within this continuum? And you'll see this is a graphic that was adopted from a resource we found in a literature review of peer support, and that lit review is also available for you to download. And it came out of research looking at the adult consumer peer movement, and you'll see where we've adapted and added in specific components, including the youth programming, youth groups that you may have in your community, as well as these formalized peer roles that you may be introducing into your service setting. So as you work with your change team, the question here is, where does the peer support that you're building fit within this continuum? And then very briefly, I get to introduce you to this idea that youth peer support can look so different, and there is such a wide variety of potential for this role that we're building in our work. And so I love titling this The Many Hats of Youth Peer. We call this position different things in different communities. So maybe you have peer mentors, maybe you have peer specialists, maybe you have peer providers. And regardless of what you call the youth peer, as you're planning to bring this support to young adults, we need to think about what role the peers will play. And I think oftentimes our calls center around this idea of, what do we call the service and the peer that's offering a very formalized one-on-one relationship in a service setting. And that is definitely a conversation we can have, and very much what today's webinar is focused on. I would be remiss if I didn't mention the other roles that youth peers play. So we see in many communities the role of peer being used in an outreach and education way. So for those of us that come from a youth engagement background, we know that one of the key ways to appeal to young adults, to invite youth, to convince them to come and access whatever you're offering, is to have them be invited by a friend. So youth recruit youth very well. And so as a youth peer, one of your responsibilities may in fact be to help sort of translate the services that are available to fellow young people and help them come to realize that they may in fact want to access those services. Youth peers oftentimes are able to access training that will support their work to become a trainer or a facilitator. So they're a young adult with lived experience who has received some formalized training, and with that they can become very, very powerful and motivating trainers of other folks about the value of youth voice, the value of lived experience, and the value and role of peer. We also see in communities who have been implementing peer support for a while now that they have built a continuum for their youth peer providers to follow. And so after you've been providing peer services and gained that experience, you may be transitioning in the future into a role of coaching or supervising your other peers, sharing your building on your lived experience and your professional development to take on new roles. Another hat that youth peers play, which I think is very important for us to consider how we will play out in our communities, is that of a youth voice role. So many of us may be including young adults in advisory councils, in work groups, in focus groups. They may be included in our evaluation efforts, in a CQI process, and oftentimes that youth voice comes from outside of our organization, and we recruit and bring that in. When we make a commitment to hire young adults and bring them onto our staff, we now can embed youth voice within that very organization, and youth peers can be recognized as experts with lived experience, and they really bring a lot of value to your organization. So this might include roles outside of a more formalized peer service that they offer to their community. And then, of course, I'm guessing many of us joined today's call because we really are looking at developing a formalized service. And in more formalized roles, youth peers will be doing things like one-to-one direct youth peer support. They may be facilitating and guiding peer support in a group setting. And they may also frequently have job responsibilities, which is sort of another hat of doing youth programming and youth engagement at some level as well. So for whatever reason you're joining today's webinar or the work that your community is currently planning, there are these many hats for youth peers to wear. And I don't get to have more time with you to delve into that today because we have other rich content to get to. But we do have this free webinar series that all of this foundational material for you to further explore, and the recordings and PowerPoints and resources are easily available for you there. I am also very excited about the number of questions that you guys are all asking, and so we will sort of, as presenters, figure out how we split those questions up and answer them, but do know that we are saving plenty of time, seemingly appropriate, to address your questions throughout today's webinar. And with this idea of all that young adults can do in our work and in the role of peer, I'm going to pass you over to Bree to talk a little bit more about where youth peer support may be fitting in your work.
Great, thank you, Johanna. I'm having a little bit of technical difficulty, so I might turn to you, Johanna, in advancing of the slides. So as Johanna mentioned about kind of the many hats that young adults are currently wearing within their communities, as well as thinking about peer support across a continuum of very formal opportunities as well as informal opportunities. One of the things that we need to really consider is kind of the best fit for where young adult peer support fits. And we often hear two kind of approaches to young adult peer support. And the first is, well, if the children's system is kind of building a movement for young adult peer support, we should just modify the existing family peer support structure and curriculum that's in place. The other side that we often hear for communities that are primarily working with young adults of transition age, well, young adults are over the age of 18. Don't they just fit into the existing adult mental health peer movement? So this graphic here kind of helps us think about where does young adult peer support fit, and where do we need to consider the similarities and the differences, and when we may need to really truly understand that we are building something new that complements both the existing family support peer structure as well as enhances and complements the existing adult peer movement. And so in this first kind of child system graphic that you see around best fit, normally our values of community-based supports and opportunities kind of fit into this teaming approach where there's the parent or the caregiver, the child, and the provider, and there could perhaps be others also supporting the family during the challenging times, such as informal peer supports, family members, those more natural supports. As the child kind of ages, they move into this transition period of where the family unit is primarily more parent and child. And sometimes that period of time can be very challenging and very complex for families to navigate. One, because the systems don't know exactly where this young adult population fits. In some states, young people, even if over the age of 18, are still able to utilize and access children's behavioral health services in the child system up until their 21st birthday, which allows the parent to still remain actively involved in their child's and young adult's transition. It still opens up opportunities for a lot of different types of services available. And then other communities, once you turn 18, you kind of age out of that children's behavioral health system, and some of your options become much more limited as you move into the adult system. And as you transition into the adult system, it really becomes about the individual and not so much about the family unit. And it's more about what does that young adult need and what will qualify them for services. And when we think of that traditional service approach of continuum of supports that are available that are connected directly to treatment and services, we see that there's some kinks in that process. The kink is that the role of family becomes minimized and the role of the individual kind of steps forward into making their own decisions, which can be a very scary time for someone who's 19 years old to be making these very large decisions, and a really tough time for family members to kind of step back and allow their young adult to step forward in the decision-making process. So when we think of young adult peer support, it's not about fitting into the existing structure that's in place for family members to access peer support through a family partnering program or family support programming and curriculum. And it's not also a best fit to just jump into the adult system. We need to consider that the values and the principles of how services and supports are available and offered to young people, they change. In the child-family system, the parent gains access to family support partnering based on the child's medical necessity. And as the child ages, that same diagnosis may not qualify in the adult mental health system to gain access to particular supports and services that are absolutely needed. Nor in the adult system is there really a strong family movement where families can still gain access to family support partners, where they may still be able to receive their support. So there's some value differences within the system that do tie back to the more formalized diagnostic pieces. And this is where Youth Move National is really trying to kind of broaden how we think about young adult peer support on a continuum, is that if we don't qualify for the high-end, very formalized service aspect, do we still offer young adult peer support to young adults who may not qualify for a higher level intensity of service? And that's why we're really thinking of this continuum of having the informal opportunities and then the much more higher-end medical necessity-oriented opportunities attached to a treatment and or a service. So we have to really think about how, as a movement, and as systems leaders who are advocating for young adult peer support, is how we are thinking about the utilization of peer support starting much earlier than an 18th birthday. And how does that transition look within a system? So if we start young adult peer support in a children's behavioral health setting, can that young adult peer follow with the child and or teenager as they age into the adult system? A traditional service approach is that when you have a birthday, you lose all continuity of care. And we're thinking that young adult peers could serve as some continuity to help with the transition from a children's behavioral health system into adulthood. And part of their adulthood may also be to access more formalized services. And so really thinking about what does that look like, because that shifts how we think about curriculum, how we think about readiness, how we think about training a young adult to provide services both in a children's system and an adult system. The legal implications look very different, providing peer support for someone under the age of 18 in a child system, where the parent is still potentially the primary decision maker, versus when they're in the adult system and the young adult is making their own decisions. We also have to think of the historical context that comes in play through this transition. And when we think of the existing adult peer movement, their worldview of their personal experiences shifted as they were moving out of institutional settings back into community. The generation of young adults currently, they have not experienced that same level of institutionalized care. The community-based support systems of care often are developing within and keeping children close to their families and working really hard with family reunification makes the younger generation of adult peers with a very different experience of the mental health system than those of older adults. And so we also need to consider how we developmentally and appropriately match peers on both sides of the system, the child and the adult side, as they age. which requires a different approach, a different unique perspective as when we train and prepare young people to offer these services and or to engage within these services. We have to think creatively around the continuum of helping relationships and the many hats that young adult peers are offering, but really what does that look like? Is it in a group setting? Is it electronic peer support that's happening through text messaging and online? Is it really attached to the higher end services such as high fidelity wraparound and or an adult ACT team? Is it more group-based and doing wellness action and recovery planning with young adults? Where does peer support best fit for this age group? And is it more of a community-based kind of drop-in outreach center as a starting place to make connections for young adult peers? And once they enter in and they have a higher need, perhaps then they get connected to a more formalized system. So as we are building this understanding of young adult peer support, we have to think of the differences in regards to how each system operates and finances their current existing peer structures. We also have to think of young adults and adolescents who don't want to be connected to mental health services their whole life and at some point still want to be connected to other like-minded peers and have opportunities for safe places to go and engage, but yet that might not be services. Transition age youth tend to want to have their basic needs met. They want employment, they want housing, they want to know where their next meal is going to come. And if those kind of basic needs are met, normally what happens after that is they realize that they have some mental health challenges and they may need to be connected to a formalized system. So we know that youth are accessing the services in the mental health system differently. And so creating a continuum of peer support that is across the age spectrum, across systems, is really pivotal. And you need to have these considerations both on thinking about what competency-based young adult peer supports look like. So what does one need to know to do the job well in both systems, and understanding the nuances of working with someone who's a minor versus working with an adult who can make their own decisions. We need really strong leadership buy-in across the system and within the organization to really understand that we're paving a way for a new experience of young adult consumers. And that may need to come with a different service approach. And then, of course, we talked a lot about the success of young adult peer programs within the context of the organization and really that strong foundation of youth leadership opportunity that starts and really are organizations ready to really truly embrace kind of this new approach to young adult peer support. So there's a lot to consider, and it's really important that we encourage you all to have very thoughtful and intentional conversations about where you want your young adult peer support program to fit. And as you develop that, you understand all aspects that need to be considered, and then what would replication look like if you tend to expand that beyond an existing system. So Youth Move National has been conducting a lot of review of existing system of care communities and healthy transition grantee sites and others who are really exploring the development of this young adult peer support. And in some of the previous webinars we mentioned can give you a much more in-depth understanding of kind of where the field is nationally. But we'll go over and kind of touch on some of the key components that we've learned nationally that tend to be working well for folks. If someone could just advance the slide for me, that would be great. So when we think of supporting young adult peers, the organization needs to take into account the developmental factors to build an effective peer program. So it starts with the planning phase and really thinking about what is it that we are building or adding to our existing service array. And Youth Move National really wants to make sure that who is driving the conversation of what is needed within the system is young adults. And our youth and young adults infused within that planning and the development process. Programs will be much more successful if they are created by and for young adults. It makes them more appealing. It supports with accessibility, and it really meets their need versus having a system drive this need based on a state expectation or a particular deliverable on the state side, and just kind of adults creating a system for young people which they may not find appealing or useful in their time of need. It's really important to, within your planning process, to have the creation of ongoing and continuous feedback loops. Really providing good communication with the planning team about what is working well and what might not be working well, so that you can truly understand how you're designing a system based on lessons learned that might have already happened within your state, as well as within the existing family or parent movement, as well as understanding what has happened within the adult peer movement as well. Young adults often, when they have a better understanding of the struggles that both parent advocates and other adult consumer advocates have had to go through, they have a better appreciation of kind of where they are in the here and now and what they may need to understand in order to truly develop programming that works for everyone. What we're seeing nationally is that training and curriculums have been the #1 ask of states and communities looking to develop young adult peer support. And Youth Move knows that there's not one particular young adult curriculum that's kind of an off-the-shelf and ready for purchasing and implementing. And so what we're learning is that communities are really looking at adapting or developing their own training. So we have seen many communities that have shifted and adapted a family peer support curriculum within the children's behavioral health system, where young adults actually went through the parent training and then offered feedback around, this doesn't work for me, I didn't quite understand that, I'm still unsure about this. And then they took all that feedback to help enhance that existing parent curriculum to really meet the needs of young adults. We're also seeing the flip side. So many adult consumer movements, there are some curriculums that can be purchased off the shelf and from developers, and young adults have often gone through those experiences as well and then said, well, this language, I don't understand what, like, recovery to me as a young adult doesn't really work for me because I don't know what I'm recovering from, because I've never experienced life without my mental health diagnosis, nor do I have a substance abuse issue. So for recovery, that's a term that in the adult world tends to be very popular and very universal, but in children's mental health, it's a term that doesn't necessarily click for young people. So they're not quite sure what recovery-oriented services are because they're really focused on more wellness and resiliency language. So having young people attend those trainings and then offer that feedback allows the community to figure out where in our training of our existing curriculums may we need to make some modifications and adaptations for this age group. The experiences of young people are very different now. So when we do case vignettes and case studies and different ways of teaching methods, we need to take into consideration the developmental needs of young people and what those experiences will look like, because the use of technology looks very different now on how young people connect versus how those older than them may connect. And we need to make sure that the learning approaches actually meet their need and that there's support in place for young adults to make sure that they can meet the certification and the fidelity criteria that some curriculums do come with. We are seeing with some young adults nationally, those that do go through traditional adult mental health curriculums, they're really struggling passing certification testing. And some communities are really delving deep into what that means. And that means, is it a language barrier? Is it that the content does not match the testing? Is it that the questions just don't connect to an experience that a young person would have, even if they're coming out of the child system? So those are all considerations when you're thinking about what your training modalities would be to help young adults kind of serve in the capacity of a peer. The other elements, which are much more organizational elements, is really to think about how one would hire and supervise young adult peers. And what we're learning nationally is that recruiting young adults can be a challenge. We often see communities that are working with graduates of existing mental health services. So if the young person has kind of completed their high-fidelity wraparound, folks feel that they might be the best suited for providing peer support within another wraparound model. So they're able to recruit through graduates. We are also seeing that those that have very strong youth leadership, youth advocacy programs, they actually have a group of young people that are already ready in a bit of a different way. They have the lived experience, but they also have the leadership elements brought into, and that you can kind of recruit right from within your youth involvement structure. We do need to consider the organizational policies that will impact practice and hiring. Things to consider is if you are working in a children's mental health system, what policies might be prohibitive to having young adult peers involved, and that might be a transportation policy or a background check policy in regards to what criminal activity within your mental health agency or licensing board. Is there some discretion versus what are the non-negotiables for hiring? There's also looking at hiring and having effective job descriptions. Like, this is new, this is innovative, and for a young adult who this may also be their first job, they really have to have clear expectations of what is expected of them. We're seeing a lot of young adults not be successful in the positions when the organizations don't have a good sense of what the role is and the types of things the role is expected to do on the job daily. We also are looking at kind of the gauging of readiness. So the readiness on the organization. Are you ready to infuse young adult voice into your organization, as well as value the lived experience that they bring and how that may differ than other lived experience positions that you may also have embedded within your organization? But then there's also the element of how do we know a young person is truly ready within their own lived experience? And is that readiness, does that mean that they're ready to serve in this capacity as a peer, or does that mean that they're ready enough to serve your community and the mental health field in other ways? And not all young people who have a mental health challenge and successfully graduate from a mental health program or a treatment service such as wraparound, do they want to be young adult peers? Do they want to do youth leadership? Perhaps. Do they still want to have pro-social opportunities to connect with others? Absolutely. But it doesn't mean they want to serve within a paid role as a peer. So you have to understand, and there's some resources that Youth Move National offers that helps you kind of think about what is the experience of a young person who enters in as a service recipient, and as they develop their own leadership and self-efficacy and their own understanding of their worldview, how they could contribute in other ways to the system as well. Most importantly is supervision. Supervision for this age group and for these roles look very different. There's kind of an administrative component of supervision, like are they showing up to work and are they meeting the needs of the job, and are they tracking the appropriate, progress notes that they need to, and are they ready and trained and able to do the job? And then there's also this kind of shift of kind of a job coaching, more supervision that, they have an opportunity to explore what it's like to utilize their lived experience as a tool within the workforce, and what does that look like? And so those are very different. One is a much more rigid kind of, you're doing your job, and the other takes practice. It takes a really strong supervisor who's willing to coach and mentor and help build the young person's capacity within their role. And that really comes from having the workforce and the organization really value the lived experience and really understand that just because this role self-identifies as lived experience, we shouldn't assume that they're unable to do their job, but we should make sure that organizational policies and practices are in place to support them to do their job the best of their ability. We're starting to see a lot of young adults create kind of this internal and external supervision model. And those models are very appealing because it allows an internal identified staff person to really serve in the capacity of, this is what your job entails, this is what you need to do on your job, and here's the administrative aspects of the job. But this external coaching piece, we're starting to see where leaders, other young adults with lived experience who have served in these roles, are stepping into a much more supervisory coaching role. And they're collectively bringing young adults together who might be working in a variety of different settings, but bringing them together for more of a coaching, co-learning opportunity and a co-reflection opportunity. So, and it creates a safe space for that young adult with lived experience. If they're afraid to have a conversation internally at their organization and they need a place to kind of practice that conversation or talk about maybe how they're struggling with an aspect of their job, they have that safe place to do that without fear of their internal immediate supervisor saying, well, maybe you're not well enough to do this job. So it really just gives them another person to bounce off of. We're seeing this also as part of some adult mental health consumer kind of movements where they have this like statewide or regional kind of co-reflection and supervision approach that comes with the credentialing model. And then Youth Move National is really looking to create kind of networks where young adults who are serving within organizations and utilizing their lived experience, having opportunities to also connect within their state, but also having a safe place nationally. So we host a series of calls for those that want to connect, and we're really starting to see this kind of national pairing of challenges we see on the East Coast are very similar to that on the West Coast, and really kind of helping to build this consensus about what are the roles, what are the challenges within the roles, and kind of bringing that unified voice of this new generation of young adult peer and inform our work as a national organization. So we have several resources that can provide you guys a much more in-depth discussion on each one of those topics, as well as talking about existing curriculums and supervision models and things that are currently out there. And I will turn it back to Johanna, who will kind of guide you to where you can gather some of that information, and then we'll jump into some of the Medicaid discussion for sustainability. So Johanna?
Awesome, Bree, thank you so much. And everyone, keep the questions coming. They're great. If they seem simple and I can answer them in the chat, I am, and we're also sort of collecting them, and we'll address as many as we can. So on your screen here is an easy way to find your way to the recordings of the 3 webinars that we sort of view as foundational information for you to explore in your planning process. And I'm very excited for you all to hear from Diana, so I will pass it over to her.
Thank you very much. I appreciate it. So I get the exciting part of understanding the role of Medicaid and talking to you about Medicaid funding for youth and young adult peer support. So understanding Medicaid is challenging and complex, actually, even for those of us who work at it every day. So I'll start by saying that. But Medicaid operates differently in each state, and it's really important to understand the structure of your state's particular Medicaid program. This process involves researching state policies and engaging with state partners, especially the Medicaid agency. For a lot of SAMHSA system of care grantees, Medicaid is not at the table, and if there's one takeaway for you today, it's find out who works in Medicaid and get to know them very well and talk with them. States use Medicaid state plans and waivers as funding mechanisms for services, and I'm going to talk about these in a minute. But the Affordable Care Act provides an important opportunity for organizations that provide peer support to expand their scope and achieve sustainable funding and become established Medicaid providers of both family and youth peer support services. If that's what they want to do, and you've heard Bree and Johanna speak about that there are organizations for whom that's not a good fit. So peer and family-run organizations across the country have diverse organizational structures and missions. For some, it's advocacy training and coordination of other local organizations rather than the direct delivery of peer supports that are the primary focus. And for these organizations, becoming a Medicaid provider, it may not align with your mission. If a key mission, though, is to provide direct services to youth or young adults, then becoming a Medicaid provider might be a good option for sustainability and peer workforce development that couldn't be achieved solely through grant or state funding. So for some, the answer might be no or not right now, but if the answer is yes, becoming a Medicaid provider may require or create a significant culture shift for both board and staff in the organization. There needs to be awareness across the organization of the parameters for billing Medicaid and how these may limit the frequency or duration of services, as well as the number of youth or young adults that might be served. Medicaid, becoming a Medicaid provider may require an organization to overhaul its existing policies and procedures, and Bree just spoke to that, to the need to have very clear policies and procedures in your organization. But if you already have those, becoming a Medicaid provider may change some or many. For organizations that are already providing peer support services through grant or state funding, becoming a Medicaid provider means the funding source for these services is going to change, as well as eligibility and reporting requirements. And organizations may also encounter limitations on the populations that they're serving, the length of service, and the components of service. On the positive side, though, becoming a Medicaid provider doesn't necessarily mean that an organization's identity has to change. Instead, it can expand its services and promote itself as an enhanced provider, making it eligible potentially for increased funding and allowing for some growth. So what are the key considerations before becoming a Medicaid provider? Well, Bree talked a lot about them in terms of supporting peer support providers. But the key initial questions are, can you answer these questions? In your state, how does a youth or young adult access peer support? Who pays for it, and who or what organizations provide it? It's important that all of those questions are answered before you sit down to think about becoming a Medicaid provider. But there are also a number of considerations to weigh, including the process for how it may impact, as I said, the culture of the organization, the mission, the funding, diversification and sustainability, financing, training and service delivery, things like management information systems and electronic health records, and also the advocacy role of an organization. I'll give you a quick example. Electronic health records allow for the tracking and reporting of data and outcomes related to care at both the individual and aggregate levels. This capability is desired, and it's actually increasingly required more and more by providers, by managed care organizations and state Medicaid agencies. Electronic record keeping has implications for Medicaid auditing and for federal data reporting guidelines, and moving from paper files to electronic record keeping and reporting is likely to be necessary in the short term for any organization that's going to become a Medicaid provider. So organizations need to consider the implications for this transition, both in terms of cost for equipment as well as staffing and training needs in the present. All Medicaid providers need to learn skills and processes. Documentation, for example, is huge, but that can be challenging for individuals who provide really excellent youth peer support and are great peers, but don't have either the educational or related work background for the documentation piece. Training also includes requirements around certification, whether through a national or a state-owned program, and Medicaid can also require training and, in some states, certification within specific time frames. And since staff training is a part of an organization's operating budget, but it's not a Medicaid billable activity, organizations need to come up with creative and cost-effective ways of delivering training to staff, like virtually through webinars or online learning modules and things like that. Determining the staffing model is critical. Peer support providers can be hired as full-time or part-time employees with benefits, without benefits, as contract employees. those things need to be considered, as well as whether to build or maintain internal clinical capacity in an organization, or get external consultation, or develop co-supervision models with other providers. Additionally, other important considerations for organizations that have them are current supervisory partnerships with providers who may be overseeing key peer support staff that are working on child and family teams. So that needs to be considered as well. I mentioned management information systems. As peer support providers, organizations collect and report information about the children and families that they serve, and youth and young adults as well, and are required by Medicaid to be in compliance with documentation and reporting requirements under HIPAA, which is the Health Information Portability and Accountability Act. These requirements include ensuring privacy and confidentiality, securing proper releases, mandated reporting, establishing and maintaining grievance procedures, and collecting progress notes and detailed demographic and personal information in secure electronic data systems. So there's got to be designated staff or consultants to compile the data and reports to submit for Medicaid reimbursement, and that's certainly a consideration for organizations. So now I get to talk about the Medicaid authorities used in funding children's services, and there are many different ways you can do that. Services can be covered through the 1905A authority of the Social Security Act. So it's Section 1905A of the Social Security Act. So what people are most frequently familiar with is either targeted case management, also known as TCM, or rehab services. So in your state, that may be covered under Medicaid. Youth peer support or adult peer support or family peer support may be covered by Medicaid under the targeted case management or rehab services under the 1905A. The 1915I gives states an opportunity to amend their state Medicaid plans to offer intensive home and community-based behavioral health services that were previously provided primarily through the 1915C Home and Community-Based Services Waivers Program, things like intensive care coordination and respite, as well as family and youth peer support. Health homes, which are Section 2703 of the Affordable Care Act, provide primary care and disability-specific service needs, as well as care management and coordination for all of the services needed by enrolled individuals. So the major goal is to provide more comprehensive, coordinated, and cost-effective care for people with chronic conditions, including children and youth with serious emotional disturbances, than would generally be provided when the services are fragmented across multiple health providers and organizations. New Jersey is an example of a state that was approved with a plan to use its care management entities, which I mentioned when I introduced myself, as health homes for children with severe emotional disturbance. So they're rolling it out geographically, and they're starting in one county and adding the physical health components to the care management entity. The way care management entities work in New Jersey is that they partner with family-run organizations for family peer support, and so youth peer support, as it rolls out, will be part of the children's system of care and will be part of that health home model as well. Money follows the person, or MFP, is a good tool Medicaid authority to use for transition, and some states have it. And as I said, if you get to know Medicaid in your state, you'll find out whether your state uses MFP. There are several states that do. It's good for transitions. It allows states to offer community-based services and supports for up to a year to individuals who are transitioning from qualifying institutions back into home and community-based settings, including children and youth 21 years of age and under, who have been in psych residential treatment facilities or in psychiatric hospitals for at least 90 consecutive days and are transitioning back into the community. So states can provide additional services like peer support, for instance, but they are required to have a plan and be able to meet the needs of that individual after that 1 year or 365 days that MFP is good for, because money follows a person is only good for 365 days after transitioning out. And the Balancing Incentive Program, which was also created by the Affordable Care Act, Section 10202, it authorizes states, grants to states basically to increase access to non-institutional long-term services and support, and help states to comply with their obligations under the Americans with Disability Act, under the integration mandate of the ADA as interpreted by the Olmstead decision. So it's complicated, and your state would have already had to apply for the balancing incentive program, but most states that were approved under the program included mental health services in their rebalancing efforts. So that's why it's included here. And it's worth knowing whether your state has that option or not. Medicaid also has 4 primary types of waivers and demonstration projects. With the 1115, states can apply for program flexibility to test new or existing approaches to financing and delivering Medicaid and CHIP, or the Children's Health Insurance Program. With the 1915B, states can apply for waivers to provide services through managed care delivery systems or otherwise limit people's choice of providers or direct them to certain providers. And I mentioned the 1915C. With it, states can apply for a waiver to provide long-term care services in the home and community rather than in institutional settings. With concurrent waivers, states can apply to simultaneously implement 2 types of waivers to provide a continuum of services to individuals with disabilities and the elderly, as long as all federal requirements for both programs are met. So Louisiana is an example of a state that implemented their children's system of care a few years ago using a concurrent 1915B and 1915C waiver. And Wyoming is an example of a state that has a 1915C children's mental health waiver, and they're pursuing a 1915B in order to implement their care management entity statewide. And peer support is a part of the care management entity model, so that's why I mentioned Wyoming as well. So, strategies for funding youth and young adult peer support exist in states across the country. The funding approaches include the covered benefit through Medicaid or private insurance, hopefully private insurance someday. I don't know of any states right now, but I put that up there because someday I'm hopeful that they will cover that as well. Block grants certainly help to fund it, state general revenue, and more recently with the passing and implementation of the Affordable Care Act as a component of behavioral health homes. While states use a variety of funding approaches to finance youth and young adult peer support, ensuring the sustainability of the services beyond grant funding has been a huge challenge, and leveraging Medicaid is just one strategy to help ensure that. I just want to stress that Medicaid is not the answer, and it shouldn't be the sole funder for peer support. If you've got state block grants, if you've got foundation funding, if you have great donor relationships in your communities, if you have faith-based partners, you should continue to work with them and to collaborate with them and to foster those relationships and keep them. But Medicaid is definitely one approach for sustainability beyond grant funding, which states really need to explore more and communities need to explore more. So some key takeaways, and then we'll stop talking and hopefully open it up to conversation and questions. One size certainly does not fit all. Medicaid is very, as I said before, individualized to the state that you're in. You need to know your own Medicaid program. You may have one or more waivers. You may have one or more state plan amendments in your state. It's important to know what you've got and what you've got to work with. Early and ongoing stakeholder engagement is a key to successful implementation. And I can't stress enough that engagement with Medicaid is key. Learning the languages of state agencies, funders, providers, et cetera, facilitates collaboration. Learn your state's Medicaid language. And then thinking about sustainability from the very beginning and laying the foundations of the organization and sort of not waiting until that 3rd or 4th or 5th year to start thinking about how the youth peer support is going to be sustained, but giving some thought to what Bree had said about, how is this different than the other peer support in the state, and how do we build this for what youth and young adults need rather than being towed along with what was constructed maybe at the beginning for adults or at the beginning for parent peer support, and just sort of tacking this on at the end. So very important to give some thought to that as well. So with that, I'll turn it back over to Johanna.
Awesome. Thank you so much, Diana. I always have to take a deep breath after we present together and think about all that we just laid out for you. when we did those polling questions at the beginning of the webinar, we figured out that those of you on today's call are, for the vast majority, in the planning process to implement youth peer support. Most of you are not providers of services that you're currently billing Medicaid for, and almost everyone is engaged in youth engagement. And so that is a perfect fit for all of the messages that we're sharing today, and we hope we're not overwhelming. We want to be helpful and thought-provoking. So we do have some questions that have come in already that we may have touched on briefly, but we would like to address in a more in-depth way. And while Bree and I touch on those questions, please consider typing or chatting in additional questions, and we'll follow your lead in the conversation. So Elliot was great and brought up something about language that's really important to this work and important to me. And so I wanted to say out loud the response I shared with him. And so the question was in regards to the use of the word recovery, and specifically for young adults who have experienced trauma. And I'll step back from that question for just a moment. We have come to this work understanding that states who are implementing youth peer support are often experienced in providing adult peer support and or parent peer support. Especially in the adult movement, the recovery language is strong and well understood. What has not happened very often is a deep discussion with youth advocates about how they understand the word recovery. And Bree said it very well. You know, to recover, to return to prior, you know, to your previous experience before you had a mental health diagnosis often means returning to a time when you were a child. And that's hard to reconcile when you're looking forward into your future. You're a young adult trying to build a future life. And so this is not a universal consent, but we do hear very frequently a preference for words like resiliency and wellness in replace of recovery. We do hear rather strongly from young adults who have experienced a substance use challenge that recovery does resonate for them in that portion of their lives, but they don't use it as frequently in relation to mental health challenges. And so what we are encouraging you to do is to not just use the word recovery, instead to convene that dialogue with your young adults to determine what word is most helpful. And lots of states are finishing or in a process of creating a recovery definition to use statewide. And if your state is in those conversations, the question is there a youth voice at the table? And so we have worked with communities who have prior definitions of recovery defined, and they're revisiting those definitions with young adults to see if they can add in these resiliency components. The second question that I was going to address was the idea, someone asked very specifically how many states are billing Medicaid for youth peer support. And I laughed and I didn't open my spreadsheet to start counting. We have interviewed 18 plus states about their youth peer support components. Not all of those states, and we completed those interviews several months ago, not all of those states were billing for youth peer support. The majority were. They were all billing in different ways. So of those options that Diana has shared with us, there was a diverse sort of options available for folks. And then since we completed that set of interviews, we have worked with several states who have amended their state plans to include youth peer support, and they have not yet developed the service. So they have the option now available, and they've now started the planning process to think about curriculum and certification and what agencies would be hiring the peer. So it's a very mixed bag question. If you're looking for like a specific type of example, we'd be happy to direct you to the state. And in the guide that will be released later this month, we did include profiles from a handful of communities to specifically get at that answer. Like, how are folks financing this, and within the wide variety of Medicaid options. So Bree or Diana, do you have additional thoughts on that question?
Yeah, and this is Diana. I would just say that, whenever I hear that question, I sort of wonder what the question is, because there's reimbursement through Medicaid for components of peer support, and it's called something else, like community support or care coordination or rehab or something. So a lot of times, states like California and Ohio have really robust community support services that providers just bill lots of different services under, and it's not called peer support or youth peer support, but it's a mechanism for payment by Medicaid. There are also states that, Georgia's one that's working on having specific explicit language in their state plan and a code for certified peer support youth. That's the service. It's delivered by youth to youth. And it's very explicit, and it will be a Medicaid billable code for that explicit service that contains a bunch of different components. So I think that's the kind of confusing thing, is that states, probably a lot more states, bill for pieces of youth peer support potentially than, and almost none bill for that which you call explicitly youth or young adult peer support, and that's confusing to people.
Yeah, I think that was very, very helpful, Diana. Bree, do you want to take a couple of these questions that are more specific to the hiring based on age and experience?
Great. Not a problem. So in the environmental scan and the efforts we've been doing, we've been learning more about programs and some of the age requirements attached to that. Youth Move has been very intentional with not necessarily attaching an age, because I think it is dependent on the need of the community and or the service and how that will be funded. So we have interviewed communities where they only hire someone over the age of 18, but they provide the service to those under the age of 18. So that is one hiring model, and some of the justifications on why only hiring over the age of 18 is because of the service setting in which the service is provided. It is attached to a treatment. It is offered, and the hiring entity is a mental health agency who follows some of their own credentialing and licensing standards, which requires everyone to conduct a background check. And so that is one requirement in HR process that they cannot kind of minimize and do away with. However, they have been able to work with that process to look at what types of criminal background check items that might come up on a background check that could be overlooked in order to hire. So some mental health agencies, if there's a traffic violation, if there's a minor offense, and it is still on their record, they have been able to work with HR departments to overlook that offense and put parameters in place. So for example, if it's a traffic violation, the parameter would be they could still be hired in the position, but they would not be transporting or providing any sort of transportation for a young adult that they're working with. And so that's kind of part of the speculation in order to have the job. Other organizations have been very clear with kind of some non-negotiables of what is absolutely a non-negotiable that they cannot bend the rules for, and that has been unique to various different HR departments and the way the mental health organizations and or the entity that's doing the hiring currently has to either follow their state contracts or their licensing. So that's something to consider. We also have seen organizations that tend to have creative funding, but yet are perhaps offering more of an informal type of peer support. So they might be billing for it through one of those creative mechanisms that Diana mentioned, such as a rehab option or another way that it's not necessarily tied to a specific service or intervention. And those they could kind of bill for in more of maybe a group setting or a drop-in center. Those organizations, we are seeing that they have had a little bit more flexibility in regards to their hiring protocols because they don't have the rigorous of a licensing standard and credential over their organization. And so for some of those organizations, we have seen, especially California, as Diana mentioned, they have that a rehab option in which they bill for, and they have youth kind of outreach drop-in centers. And those young adults are able to be hired at the age of 16, but it's because they're under a different structure in how the organization hires and operates their drop-in center versus that of a mental health agency who's doing direct treatment and service. We also have seen schools, so schools that are creating and building young adult peer programs, specifically for those with mental health challenges, also utilizing young adults under the age, kind of serving